I also wanted to take a moment to recognize the passing of Charles Juravinski last week. Charlie was a longtime supporter and champion of healthcare in Hamilton. He's survived by his wife, Margaret. Together, they generously donated millions and millions of dollars toward hospital redevelopment and revitalization projects in our city. Charlie and Margaret's legacy also is contained in an endowment created through the Juravinski Research Institute that will enable continued excellence in health research for the foreseeable future. I think we're all so fortunate to have benefited from Charlie's passion and generosity. He truly believed in giving back to his community, and he always encouraged others to do the same in whatever way they could. In his words, when you donate, you absolutely feel better and you walk away proud. Your shoulders go back, you stand taller. I urge each and every one of you to support healthcare to the best of your abilities. Charlie, rest in peace. Having said that, I'm going to turn it over to Sharon Pearson to provide us with an update on hospital operations and capacity. Sharon, over to you.
Great, thank you, Rob, and good morning, everyone. Happy to provide the update this week. That's a bit more positive than some of my updates in our past town halls over the course of what is many months and up to years now. In terms of our numbers, you can see them there as far as our COVID positive patients down to 47. About 40 days ago, we were sitting around 226. So it's an incredible decline and much needed decline that we're seeing in those numbers. Our ICU numbers in ICU are also declining, as well as those patients requiring ECMO. And happy to report no outbreaks as of today, nor have we had any for a couple of weeks. Over the course of the pandemic, we've had over 24 units involved in outbreaks, not all at the same time, but certainly many units impacted. So nice to see that dissipate. If we go on to the next slide, would like to say that our occupancy is a lot better. It's not a lot better, but it's better. So that's good news. We've gotten a bit of a reprieve over the course of the last couple of weeks, maybe 2 weeks. Feeling a bit better as far as flow goes, particularly at our acute sites, but the pressures are still high. And as we know, it can be very variable. But you can see our numbers there. We are still really stressed in our med-surg occupancy. You don't see those specific numbers on the slides, but we've been as high as 120% with our demands for medical beds spilling over into surgery. That number, again, is starting to decline, which is great news, but still not where we need it to be. And our ALC numbers remain about 200, 205 consistently now. Again, last year, we got almost to 100, so we have seen almost a doubling of our ALC. If we go to the next slide, in terms of the resumption of our scheduled and procedural care along with our ambulatory care, I did report last week that there was some lifting of Directive 2. In February 10th, we were actually informed that hospitals could ramp up as far as 70% of their pre-COVID activity. When we think about the considerations in order to do that, we have to think about our occupancy rates. We have to think about managing those very high numbers of admits to no beds that we can experience, as well as our unfunded bed challenges. So we've been as high as 100 unfunded beds open. We're starting to see that number also decline, but still dependent on the range of 40 to 50 beds at any given time. And of course, the very significant health human resource challenges that we're experiencing right now, driven by a high number of vacancies. So our process will be very thoughtful. It will be very gradual. And we are, and you'll hear more from Kristen talking about how we can redeploy the staff back to their home units, but also at the same time mitigating for the pressures that several units feel with some significant shortages. If we go to the next slide. In terms of how that translates, we have been progressively increasing some of our activity in cancer screening. We did not ramp down considerably in diagnostic imaging, but are bringing back some of those lower acuity activities that had been paused, along with some of the ambulatory care activities. Over the course of this week and into the end of next week, we will be slowly increasing our scheduled care activity, both in the operating room and procedural care. We do hope by the end of next week to have some OR blocks open at the General, the Juravinski, and McMaster Children's, along with some procedural work in EP and along with the HIU. That will bring us to about 60% of our pre-COVID activity, which is below not only the 70% provincial threshold, but also our own threshold of 70%, whereby until we're at 70%, we know that we're impacting time-sensitive care. So we really need to get to that 70% mark. And I think the next is ambulatory. If you could go on to the next slide, in terms of, we do need to get our ambulatory care clinics, again, close to 200 spread across the sites, back to regular activities. We are slowly increasing. The priority will be first on oncology and pediatric ambulatory care, then looking at those clinics that support our procedural and surgical care activities and our ramp up, and then also those clinics that support our patient flow and really help expedite our discharges and avoid admissions and ED visits. And again, really optimizing opportunities for virtual and remote care through this. So our process will be in line with the provincial directions. It will be slow, it will be thoughtful, but we will keep everyone informed of our progress. And with that, I will hand it back over to Aaron.
Thanks very much, Sharon. Thanks for the update. Next up on our agenda is Kirsten Krall. Sharon alluded to that. Kirsten's our Vice President of Quality and Performance and our Chief Nursing Executive, to talk, I think, about deployment. So Kirsten, what do we need to know?
Great, thank you. And on the coattail of Sharon's more encouraging news today as well, goes hand in hand with our deployment update as well. So, you know, at the end of January, we had gotten to a total of about 312 individuals from HHS having been deployed to a variety of different areas of the organization to respond to all the needs that we had. And that number is now starting to come down. As of last week, we still had about 200 people that had been deployed, but we are now chipping away at getting people back to their home units. A little bit of trickle started to end of last week, but certainly much more this week as of Tuesday, Wednesday, and even more will happen over the course of the week. And then next week as well. So extenders are individuals in extender roles. Many of them are a variety of different clinical and non-clinical backgrounds that were in these extender roles, we call them. But they will be, for the most part, going back, probably about 90% going back in the next few days, and then clerical roles as well. So much like Sharon just talked about, some of the ambulatory areas, some of these roles are really key to getting some of that support in those areas. So the majority of these roles will be returning over the next few days. The Odyssey credentialed trainers, of course, our Odyssey undertaking is a top priority for us. Those trainers were in some cases held back from starting their positions, and others that actually came back out of their role temporarily. But they were all returned to get going on the credential training role at the early part of February, about 25 people or so. And then we are also starting to slowly look at clinical roles that can be progressively released, again, to support the ramp-up work that Sharon has talked about. And in some areas, they've become much more stable that we can release them. But we're also very mindful that there continue to be some high pressure areas. And again, we don't want to destabilize them. And again, we still certainly have COVID patients that we're looking after. So again, not everybody will be released, but we are definitely progressively getting people back to their home units and their original roles. There is a centralized process to coordinate all this work. The VPs, the clinical VPs with Sharon and myself and Nate Vandenduel from Central Scheduling Office, we're in constant communications, I would say these days, around what this picture looks like. So who can be released? Again, trying to do that with a lot of thoughtfulness. And again, trying to really be committed to not keeping people any longer than they should be, but at the same time, trying to manage all these different moving parts. There are some individuals who may end up staying a little bit longer in period of time, but again, hopefully we'll in the next few days have a little bit more clarity around specific dates that people can return. And in some cases, although rare, I would say likely, but in some cases we may need to deploy or redeploy somebody to another area where we really need to still fill a gap, but where somebody needs to come out to get going with the procedural work. Next slide. So individuals got notice last week around their schedules being extended to April 6th. Some of that for sure in the ONA world and our collective agreements. You know, that 6-week line of sight has to be articulated. So that's what we've done. However, it's not a hard and fast rule. Just people needed to have a sense of when schedules were extended out to so that they could also plan their lives. But certainly, again, like I've mentioned, we will try and get people released earlier than that. And again, people getting some warning of when that will happen. In the meantime, though, we have also asked our managers to avoid doing any independent decisions around releasing individuals because we have to look at this big picture to make sure it's well balanced and that, in fact, we can meet all the different goals that we're trying to achieve with this plan. And, you know, certainly people's skills and experience that they have makes a big difference in our decision making as well, to make sure that we're almost trying to find the right person for the right work to meet the needs of our patients. And that's really what it comes down to, is making sure our patients are in safe hands and that we can carry on. So again, trying to make sure that we aren't destabilizing anything along the way. So this is good news. I thank everybody. And I just want to call out, you know, for the 312 people who stepped up into this work. It took a lot of courage for many, many very patient. I know it could be very emotional, no doubt about it. So I am very proud of all of you who have done this. I do want to also do a shout out for those individuals who weren't formally part of that deployment list. We had a lot of other individuals picking up other clinical work, even if it was maybe a day of the week where they came out of their regular work to do that, or helping with break relief and so on. Like, people in all sorts of different ways stepped into this, although they weren't formally part of deployment. So thank you for many, many efforts that people had put forward to really look after our patients and our organization. So on that note, I'll turn it back to Erin. Thank you.
Awesome. Thanks very much, Kirsten, for that update. And next up on our agenda is our epidemiology update from Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control. Dominic, is this pandemic over yet? Hopefully you've got some good news today.
I think I can follow up on the good news that have already been shared here. Only a couple slides on case numbers, as I mentioned previously, not very useful in any way at this point of time, but basically you see it continues to decline within all the limitations and how limited its value is at this point of time. Next slide. The same here for Ontario, and I just added sort of the major shifts in policy here. We probably peaked in second to third week of January, latest probably second week. Again, we don't really know, given that we would have changed our testing criteria. But what you can see is we started to drop very quickly with the change in testing criteria. We went into modified stage 2. Cases continued to decline. We went into modified stage, we ended modified stage 2 and we continue to decline. So all good news at this point of time. Again, take it with a grain of salt, given that testing isn't what it used to be. Next slide. This is much more meaningful and gives us a much better picture, but lacking behind 1 to 2 weeks in terms of by when you would see a change in trajectory. So that's hospital admissions in the province that you can see compared to peak, roughly 73% reduction in the 7-day average of people hospitalized with COVID. And on the next slide, you see the local situation in Hamilton. And while I would have told you 2 weeks ago that we were lacking behind, we are no longer lacking behind in terms of reduction in COVID cases. We have exactly 73% reduction as well when looking at the 7-day average as per yesterday. So pretty much in lockstep with the provincial average in terms of the reduction that we do see currently. Next slide. ICU admissions here, the provincial view, today less than 300, as you can see. So roughly 50% reduction compared to peak, which was just above 600. You also see the number of ventilated patients here at 192, again, roughly 50% of the max, which was just a little lower than 400 when we had our ICU peak by mid-January. Next slide. Now the big question is what's to come. And as you know, with models, we sort of try to get an idea. The good news here is, well, I will put it that way. The models resulted in a lot of anxiety, given that it suggested that here in terms of hospital admissions, we will not see a big decrease and we will relatively suddenly or relatively early see another increase. That hasn't materialized yet. You see here that we are, with the black line, currently sitting at 1,000 hospital people in hospital with COVID. We are pretty much at the bottom of what was considered plausible in those last provincial predictions. Next slide. And in terms of ICU admissions, we are actually below of what was considered plausible. As I mentioned, we are just below 300 at this point of time. Next slide. These are our local models. And again, this is number of hospital admissions per day. So a different metric that's being used. Based on this model, we would have expected to still see roughly 8 admissions per day. On average, we are down to 1 admission per day among Hamiltonians, that is over 7 days. So a lot of good news to share. I think reality is we will see an increase in hospital admissions again at some point. Only I cannot tell you when that's going to happen and how significant that increase will be. And as you can see, the last set of models wasn't able to pinpoint that. Maybe the next ones will be more accurate, but it's very difficult at this point of time, given the lack of information on actual case numbers. And probably the main driver of what we are going to see in the weeks and months to come is probably how many people would have had Omicron and how long that immunity of consisting of vaccines plus Omicron will hold up. And it's still too early to tell that. So still lots of uncertainty, but certainly the good news are out there right now. And we are certainly in a much, much better position than 4 weeks ago. Handing over to you, Aaron. Thank you.
All right, thanks very much, Dr. Mertz. Next up on our agenda is Dr. Barry Lum, who is fearlessly helping lead us through the Odyssey transformation that is underway. And Barry's going to give us an update on where we're at in that progress together. I think we're at almost under 100 days now, Barry, to go live.
We're so right. Hi, everybody again. Thanks for the opportunity to give you a little update. By now, everybody is getting pretty familiar with our slide here, which shows this complex journey that we've been on now for well over a year. And we are well into phase 4. And on the next slide, as Aaron said, we crossed the threshold to just 2 digits now in terms of our days to go live, which, as most of you will know, is June the 4th coming up. Next slide, please. So just a few comments about training. You've heard me say over and over again that training is an exceptionally critical part of the success of the go live. And I would just remind you that we're going to be training over 14,000 people in this organization. And it's become quite evident to me over these last few months that this is a project in and of itself that's incredibly complex. And I would be the first to acknowledge that, now on February the 24th and looking back, we most certainly could have done better. And we know that there is some frustration out there in terms of the ability to actually register your staff in the various courses. And we are aware of that. We're trying very hard to mitigate that. We've hired a few people on short-term basis to help deal with the inbox. And you'll see some communication about that from Aaron's team later today. But I would just beg your ongoing patience as we try to get us across the threshold. There has been considerable feedback that we did not have enough courses in some areas, and I'll show you when I get to it on the next slide that we're trying very hard to fix that, and we've added a lot of courses, and we'll continue to adjust. But it is not going to be a simple exercise to get us across this part of the project and the finish line in terms of getting registration done. We do have deadlines that include a February 28th or Monday coming up for the provider side of the house, which includes physicians, nurse practitioners, and physician's assistants, and then the much bigger so-called non-provider group, and we've got a couple of extra weeks to get this accomplished. I would encourage you to take the opportunity soon to have a look at the e-learning videos. The deadline to do that is April the 4th, but I think it would be really very valuable to try and spend some time on those, complete the little short 4 or 5 question quizzes at each one of them. And then as you go about your training and you think, oh, now what did they say about X or Y? If you go back to those little vignettes and their little videos, you're going to find they actually are very helpful in sort of tweaking your memory about items that you might not have picked up on or not be quite so sure about. And as always, we do have our 2 email opportunities, and we will, I expect, very soon start to be much more nimble in terms of how fast we can respond to you. Next slide, please. So these are the new classes that have been added on the clinical side of the house. There are a bunch of others on the non-clinical or more technical side. So I would encourage you, if our managers and leaders, to take a moment and have a look back and see if your concerns around the number of classes available has been solved. If it hasn't, most certainly let us know. We have ongoing work to do on the rehab side of the equation, and in particular in the OR, and that's actively being looked at. Next slide, please. So what's coming? Well, in 99 days, there's a lot coming. And I just mentioned a couple of these for you. There is something called TDR, or Technical Dress Rehearsal. This is an extremely important part of being ready to actually take care of patients on June the 4th. Every device which connects with the Epic system has to be tested and confirmed that it will function appropriately in the environment. There's been a lot of work on a pilot of this done over at Mumsy. My thanks to the patients of the Mumsy site. And we're now past the pilot stage. There's been a lot of learning, but now we have to literally go to every unit or area where there will be patient interaction and test every device. The printers, the label printers, and so on, all need to be tested. So you're going to start to see these folks on the units. We'll be starting at the Hamilton General next week. We are going to do something called a virtual pep rally soon, because we would like to be able to generate some enthusiasm and some smiles around this, and not just think that this is a big, huge task without some really fun opportunities, and you'll hear some more about that. In March, there'll be something called the ARCR Summit on March the 16th, details to follow. And we will be beginning the process of training our internal super users on March 21st. And then there was a kickoff for the super user training earlier this week. We also, next Wednesday, will be having our 90-day Go Live Readiness Assessment. This is the second of 4 GLRAs, and many of you will be invited, and I would ask you, if at all possible, to find the time to attend these. These are extremely important items as we get closer and closer. In April, the in-class training will begin. We will have something called patient flow days coming along, and then the 60-day GLRA will also take place, and the calendar hold for that should be in most folks' inboxes already. So last slide, please. So please, you've heard me say it many, many times now, don't hesitate to reach out to us anywhere along the line, odyssey@hhsc.ca. And Aaron, I'm going to pass it on to Dave now. Thank you.
Thanks, Barry, for that update and all of that walkthrough. I just wanted to add some additional comments, thanking both the Odyssey project team, all of the work streams and those within our organization that are engaged in all of this work. And also just to highlight, I guess, really it's not so much a grand reveal, but this is certainly the time of the project where many more people are engaged and actively moving into the training and all of the other activities. So a bit daunting for sure, also a bit exciting. And there's so many opportunities for each of the areas and individuals to get a chance to interact and to learn and to get more comfortable with what's coming when we do in fact go live. There will be lots of things, you know, the e-learnings are just a little bit of a you know, a little bit of a teaser trailer kind of opportunity, the in-class training, but then beyond that, there will be lots of login labs, after class opportunities, personalization labs, demos, simulation labs, you know, sort of a playground to be able to safely play in the system and try out the workflow. So there will be lots of ways that we'll make sure that everyone has a chance to use, learn, and understand the system and feel as comfortable as possible before go live. So anyway, a very exciting time as we move into most of our organization being engaged in the activities to get ready. So thank you again for all of that, and provide the feedback, as Barry said, if you have questions and concerns through your leaders or directly to the Odyssey email inbox. And here we go, 99 days. So thanks so much, everyone. And with that, I'll pass it back to Aaron.
Thanks very much, Dave, for that additional context. Next up on our agenda is Emmeline Grigorov, who is a colleague of ours in Human Rights and Inclusion. And she's here to talk to us about Black History Month, some learning opportunities, and I believe also International Women's Day, which is coming up on the horizon. So Emmeline, what do we need to know?
Thanks so much, Aaron. As Rob stated, we are in the midst of Black History Month, so I did want to take a few moments to talk to folks about some opportunities to learn more that have been happening this month. Right now, there is a Voices of HHS story on the Hub entitled Honoring Black History Doesn't Just Happen in February, It Happens Every Day for Me. It's a really excellent read that we encourage folks to check out. A meal of jollof rice was offered in our cafeterias on the 16th. A Zoom film screening of The Skin We're In happened on the 18th. And as Rob also mentioned, we do have a Black History Month calendar of learning opportunities that is available to support folks in learning more. On the screen, we've offered just a screenshot of the first page of that calendar. It's currently linked on the Human Rights and Inclusion Team Hub page. It has been shared in a few daily dispatch emails this month and was shared in the Black History Month Hub story that came out back on February 1st. I'd just like to remind folks the calendar will be on our Team Hub page all year long, and we really do encourage you to engage with it as and when you're able so that we can engage in learning more about Black history and about combating anti-Black racism every single day and not just in February. Lastly, on the topic of Black History Month, folks may have noted this week a news story on the Hub promoting an e-learning opportunity in our learning management system that's called Call It Out, Racism, Racial Discrimination, and Human Rights. This is a free 30-minute e-learning module that was created by the Ontario Human Rights Commission, and it is a fantastic learning opportunity. It isn't specifically focused on Black History Month, but we do really think it's relevant to share in the context of this month because it does focus on identifying and addressing racism in the community and in the workplace. So we really recommend that folks engage with that learning opportunity as you are able. And Aaron, as you noted, I also wanted to take a moment to talk to folks about International Women's Day, which will be happening on March 8th. Our next town hall will be after the 8th, so wanted to take a moment to acknowledge and share some information with folks now. The theme for this year's International Women's Day is Break the Bias. And on the screen, you can see a few of the Break the Bias selfie cards International Women's Day is promoting for this year. And so we certainly encourage folks to learn more about how you can break the bias to help forge a gender equal world, maintain a gender equal mindset, and challenge gender stereotypes, discrimination, and bias. We will be recognizing International Women's Day a few ways next month, although not all of these will necessarily occur right on the 8th. Our team will be working with Dr. Smita Halder to launch a Women's Physician Affinity Group, so please do stay tuned to learn more about that work. You'll also see a hub story in March that will be recognizing the unique challenges and disparities that women at HHS have encountered throughout our pandemic. So please do stay tuned to learn more throughout the month of March. And with that, I'll hand things back over to you, Aaron.
Awesome. Thanks very much, Emmeline, for that update. And I believe you mentioned Dr. Halder, and next up on our agenda is Dr. Halder to give us an update on the equity and diversity inclusion work underway through our President's EDI Advisory Council. I'm actually noting that I don't see Dr. Halder in our list of panelists. I'm wondering, perhaps Bruce Squires, maybe I can call upon you for this update as one of Dr. Halder's co-chairs, unless I'm mistaken and she is there in the mix.
Erin Smita is in the attendees list. She's just raised her hand.
She's raised. This is an unprecedented move, but here we go. Let's try and make this happen. Smita, I'm going to ask, give you the opportunity here to speak. Can you go ahead?
Hi there. Sorry about that. I was
Awesome.
in the wrong room.
No
So good afternoon. So I'm Smita Halder, and I'm the co-chair of the President's Equity, Diversity and Inclusion Advisory Council, along with Dr. Sanjay Sharma and Bruce Squires. And we are continuing our work to develop recommendations to advance the equity, diversity and inclusion at Hamilton Health Sciences. The recommendations are going to be informed by a series of inputs, including the EDI work survey that many of you have participated in, some key informant interviews, focus groups, and policy review. And I want to really thank everyone who has taken the time to participate in the focus groups. We appreciate the experiences and the insights that you shared with us. Next slide, please. The inputs are being used to identify common themes, key opportunities and challenges, and any potential gaps. And the council and its working group are in the process of reviewing all of these themes and refining the recommendations for our organisation. We're really grateful for the work that's been done by the Advisory Council with the support from Ernst & Young, and we look forward to providing you with some updates in the near future about what we've heard and the recommendations and next steps. Thank you.
Perfect. Thanks very much, Smita, for that update. And I believe that concludes our formal agenda of presentations today. As I mentioned at the beginning of today's town hall, you can always send questions that may have popped into your mind as we go. You can email those to hhsnews@hhsc.ca. And please also take advantage of that to send suggestions for content, topics. It's always helpful to have that feedback. So questions to that email line. Next up, we have our celebrations. This is an opportunity for you to recognize one of your colleagues, perhaps something you've seen across the organization, something that you'd like to recognize in terms of accomplishments, just good support for one another. If you are one of our attendees, you can raise your hand and we'll call on you to give your celebration live, or you can put it in the chat forum and we'll read out your celebrations. I see here one right now from Neil Johnson, recognizing John Shepard, Juravinski Hospital nurse who retired this week after a 45-year career at HHS, as well as radiation oncologist Dr. Sashi Voraganti retires tomorrow after 20+ years service at Juravinski Cancer Center, as well as several other centers across the world before she arrived at HHS. So thanks very much to both of those wonderful contributors to our organization, John and Sashi. Thank you so much for pointing that out, Neil. All right. See one question coming in from Sandy. That's great, Sandy. We'll make sure to put that into the email forum and get you a response to that question. And here, it's hard to keep up. I see so many streaming in now. Let me see what we've got. Recognizing our psychologists across Hamilton Health Sciences, as February is Psychology Month. That's from Marita Tonkin. Thank you very much, Marita. From Emmeline Gregorov, I would like to celebrate my colleague Shannon Kitchings, Human Rights and Inclusion Specialist, for incredible leadership throughout Black History Month and for being awesome to work with. That's a great shout out. Thanks, Emmeline. Way to go, Shannon. Thanks for all you're doing. A comment from Dr. Nachasa Johnson to Emmeline and Shannon from the Human Rights and Inclusion Office for being so open, collaborative, and receptive to feedback, and for developing the Black History Month calendar, and also the online module that I completed. So good. So thanks very much for pointing that out, Dr. Johnson, and thanks again to Emma and Shannon. Okay, just a reminder to our panelists, you can also put your hand up and give a shout out should you wish. Bruce has noted, it's been said, but bears repeating, a huge thanks to every single staff member redeployed to support the significant pressures across HHS. Yeah, as Kirsten noted, 300 members of our team. Thank you so much for all the work that you've done and for making that possible. From Krista Binnington, so much respect, awe, and thankfulness to everyone who has been redeployed. Specific thanks to our team members, Cheryl Allman, Madalena Del Silva, Nate Sorosky, Shiva Batul, and Linda Waterhouse. Each of them has risen to the challenge with great, incredible positivity and enthusiasm despite the challenges. Wow, what a nice shout out. Thanks, Krista, for making that happen. Thank you for bringing that forward. From Drew to everyone, thanks to all the EAs and porters across the sites for all the hard work they've done throughout the pandemic and outbreaks, for sure. Okay, well, I think we're reaching the conclusion of our town hall today. Maybe I can call on our CEO, Rob, for any final remarks.
Yeah, thanks very much, Aaron. I do see Dr. Johnson also had a shout out to the nursing and allied health team on 3B1, working so hard during a time of unprecedented busyness. So thanks all, as always, for attending today. It was really nice to hear Sharon Pearson's update and knowing, as well as Dominic's update, Dr. Mertz showing that the numbers are all headed in the right direction. I know still lots of challenges remain. We're still such a busy group of hospitals and continue to labor under staffing levels that are not where we'd like them to be. So thanks all for all the hard work you're doing. Very much appreciated, and let's keep our fingers crossed that the numbers continue to go in the right way. Having said all of that, I just wish all of you a great rest of the week, and once again, say thanks for all your hard work and dedication to our patients and for attending today. Cheers, everybody.